I don't think ordinary Manitobans will appreciate that the NDP wants to waste valuable legislative time patting themselves on the back when they should be getting down to work. It's remarkably tactless and insensitive and out of touch with what ordinary Manitobans expect. And this is no knock on the member for Tuxedo. I don't think she wrote this resolution. I think she was handed this resolution and said, go do your best with this. Well, then I'm not sure how the member will explain the level of alternative facts that are in this resolution, Honourable Deputy Speaker. So I would like to put some real facts on the record. Facts about what is going on in healthcare right now after a year of NDP government. I'm going to start with diagnostic waits. Instead of patting themselves on the back, they should be addressing the fact that wait times for a CT scan have skyrocketed this calendar year under them to lengths not seen since the pandemic. 25 weeks for a CT scan at Seven Oaks, a 15-week jump in this year alone. 25 weeks for a CT scan at Concordia, wow, a 16-week jump. The highest wait times have been since the pandemic. A staggering 32 weeks for a CT scan at HSC. The highest wait times have been in years, and by far the longest wait for a CT at HSC since the pandemic. Waits for a CT scan are also up 6 weeks at St. Boniface, 8 weeks at Misericordia, 6 weeks at Boundary Trails, and 9 weeks in Dauphin. MRI wait times at HSC are up to 56 weeks in August 2024, a 55% increase from August 2023. None of this squares with what the NDP are attempting to put on the record with this resolution. We should also talk about surgical wait times. The median wait time for a total hip replacement is now up to 28 weeks. The median wait time for a hip replacement revision is up to a staggering 26 weeks. For context, a year prior, that wait time was 10 weeks. That's a 160% increase under the NDP. The median wait time for a knee replacement has climbed to 36 weeks. And these are just median wait times, meaning half of patients are waiting even longer. Cataract wait times are up to 12 weeks at Misericordia. And yet, given all of this, all of these Manitobans waiting for their surgeries, the NDP want this Legislative Assembly to applaud them for the fact that surgical wait times are up across the board. How incredibly out of touch. And these wait times don't even take into account the wait time to see a specialist, which for many disciplines can be months or even years. Instead of patting themselves on the back, they should be getting down to work and creating an actual staffing plan. I remain shocked that after campaigning almost solely on healthcare and after a year in government, there is still no strategic and credible plan to staff up the areas of healthcare that need it and the geographic parts of our province that need it. They set staffing targets back at budget time, but now they've completely changed the parameters of what's considered a new hire in order to make it seem as though they've hit their target. For example, they said they'd hire 90 paramedics. They've hired 7. There's no way they're going to get to 90. But they're going to backfill with other healthcare professionals and say that it's the same. It's not the same. I'm not a healthcare professional, and I know that other allied health professions can't do what a paramedic does. A paramedic is a paramedic. If you say you're going to hire 90 of them, hire 90. If you can't do it, come clean with Manitobans about why you can't do it. In their most recent Health Human Resources staffing update, this NDP government shamelessly took credit for any number of PC initiatives as though they had implemented them. This is directly from the backgrounder to their own news release. Increased medical school seats, previous PC government. 400 increased nursing seats, previous PC government. Increased international medical graduate training spots, previous PC government. Increased residency positions, previous PC government. Creation of the provincial float pool, previous PC government. The previous government was thinking long-term, was thinking beyond the next election cycle, which I know is something completely foreign to this NDP crew. But thanks to the efforts of the previous PC government, the NDP is now taking credit for all of those initiatives. But you know, Honourable Deputy Speaker, it would be incorrect incorrect to say that the NDP had absolutely no plan when they came into government. They did have a plan to fire the Diagnostic and Surgical Recovery Task Force and to force their ideology on the healthcare system. It was one of the first things they did. Shortly after coming into office, they fired the top doctors and medical professionals that were in charge of reducing the surgical and diagnostic backlog.
I'd like the member for Real to come to order. We can't be calling across the floor like that. Honourable member for Roblin.
Thank you. After firing the Diagnostic and Surgical Recovery Task Force, the NDP refused to re-sign key contracts signed by the task force with public and private providers right here at home in Manitoba to reduce wait times and increase surgical capacity. And we've seen the devastating impact this has had on patients waiting for surgeries. In my own constituency, a well-publicized case, a lady by the name of Ann Bowman had her cataract surgery cancelled by the provider that had been contracted by the previous government to provide surgeries, and sent a letter to all of the patients saying, if you have a problem with this, contact the health minister, because the health minister cancelled our contract. They put ideology ahead of patient care. They cut options for patients to receive fully paid-for care when wait times here were too long, forcing people to go out of province and pay out of their own pockets. And we're now seeing the consequences of their short-sighted decision-making. While I still have some time on the clock, I want to talk about a poll commissioned by the Manitoba Nurses Union,
It's on the way to New York.
the results of which were
Cleveland's on the way to
published
New
on
York.
October 24th, just a few days ago. And according to this poll, an average of 88% of MNU members said that despite the NDP's many campaign promises, nothing has changed on the front lines over the past year. Healthcare workers are feeling unheard by this NDP government. And I'm going to quote from their Instagram post. This is public. According to the poll, only 12% of respondents noticed any improvement in the healthcare system, while a whopping 88% said nothing's changed. Many also shared that the new government has yet to make any real difference, especially when it comes to staffing, safety, and mental health supports. I also want to put on the record some of the comments that MNU members made on Instagram in response to these posts.
Less than 3 years.
Quote, sadly, there has been no noticeable change on the units, unquote. Another quote, not seeing improvements, things continue to go downhill in my opinion. Absolutely no change for the better. Conditions continue to decline. Things are getting worse. On the medicine unit I work on at HSC, things have only gotten worse, not better. I'm frontline addictions. They have not helped my patients with what is truly needed. Immediate access to detox and treatment beds. We have had government bigwigs pop in for the PR, not at all meeting my patients' needs. Before I conclude my remarks, I just want to say this resolution is embarrassing. Calling on the legislature to pat the NDP on the back smacks of hanging the mission accomplished banner 1 year into their mandate. Fiddling while Manitobans wait for surgery, while healthcare workers call on this NDP government for their nonsense. The members opposite are clearly too absorbed in their own hubris to see how out of touch they really are. Thank you.